name is Shirley Picard, and I have been a labor and delivery nurse since 1986. I've been a staff nurse, an assistant nurse manager, a nurse manager, and nursing director of obstetrics and labor and delivery units in Rhode Island and Massachusetts for 33 years now. I'm also a birth doula by accident. On May 12th and 13th, 1995, 24 years ago, I attended a conference sponsored by Lamaze called Labor Support Specialist Training Program. At the time, I had 9 years of experience as a labor and delivery nurse and had worked in teaching hospitals, doing all kinds of levels of obstetrical care. I thought I might be able to incorporate some new techniques and positions and do some things for patients that, I sometimes struggled with as a labor and delivery nurse. I seriously doubted that they would teach me anything that I really didn't know about. And I came away thinking, or I attended thinking that I was the expert there and I'd get a little background that would be helpful. I walked into that room and met 50 other women who were lay people, and their descriptions of what their experiences were supporting women in labor were horrific, particularly to me as a labor and delivery nurse. I was angry and felt insulted and humiliated, and I never told anybody what I did for a living that day, for good reason. I struggled with returning to the workshop the next day. But as things went on, and I was driving back that next day because I had paid for it, I really started to ruminate over the things that these women had said. And although I had been a very supportive labor and delivery nurse and I didn't do the things they said, I was witness to them many, many times, from every level of provider, from nurses to physicians to sometimes even midwives. We weren't listening to women. We weren't doing a good job. And women were struggling for the supportive care that they actually deserved. I took those lessons back to the unit that I was working on, and I eventually became a manager and decided to incorporate those kinds of practices into the care that we provided as labor and delivery nurses. I actually became a birth doula trainer and provided labor birth doula training programs to lay people and my labor and delivery staff. I made them go to it. It was mandated as part of their training. What we found was that it was a struggle to be a labor and delivery nurse and provide doula care at the same time. As a labor and delivery nurse, you are required to do a certain level of documentation and carry out orders and work with the physician team. But now we recognize that doulas and the care that we provided as doulas was so very important to the outcomes, and it really made a difference. And it was unethical for us to not provide it as nurses too. We welcome doulas into our program. We did have a volunteer doula program, but as many people have testified, it's unsustainable. We offered free training in lieu of providing doula services from those new doulas. And, the wave started way back then at the hospital that I worked at. We saw a significant decrease in our C-section rate and excellent breastfeeding outcomes. And 6 years after I attended that first course and we started to welcome these practices into our program, we won a national award for mother-friendly maternity care from the Childbirth Association and Postpartum Professionals Group. And it was because we understood that this was an essential part of taking care of the patients. We were in a community that was multicultural, and these women really, really deserved this kind of care. But we were not able to consistently provide it because we were nurses and didn't have doulas with us all the time. This is an opportunity for Rhode Island to stand out and shine and really provide the kind of care that will address the racial disparities. Not all women can afford this kind of service, but all women absolutely deserve it. I sincerely hope that all the members of this committee have listened to all of the people that have provided this testimony and support this bill going forward. Thank you very much.